Greetings, students. Today, what I want to do is talk to you just a little bit about these energy calculations that you've been working on. So I know that some of you have been working inside of our modules. So what we're looking at here is we're looking inside your Canvas courses, and we're starting to look at week 11. And you had adult calculations to work on. And then I have some information here that I'd like to go over a little bit more that I added today about more energy calculations and weight management specifically, which is focusing a little bit on chapter 17. So we're getting a little bit ahead, but I want to make sure that you know how to do this. And I want you to spend some time kind of thinking about this. So when we looked at the energy calculations, I want to make sure that everybody feels comfortable understanding that there is the Harris-Benedict, and then there's also the Mifflin-St. Jean. And there's a couple other ones out there too, right, that the article talked about, but those are probably the ones that are used most frequently in our field. And for the purposes that we find that the Mifflin-St. Jean tends to be the one that is utilized the most. So that's the formula that we're going to be using moving forward with our adult population. So be familiar with that calculation, but do you have to know the actual calculation and memorize it? No, I would give that to you. But at some point you are going to have to memorize it because you're going to need to make those calculations on your own for the RD exam. But in the meantime, not now, you don't actually have to know them. But I want you to know I would provide that for you. The other thing, though, that you might not know, but I might provide you some information, is this activity factor. And this kind of goes back to our last exam that we had. And I did not give you the activity factor, and I wanted you guys to work through how you would come up with that activity factor. So what I've done here is I've posted some activity factor and then also some definitions, because this is the other part that I don't think a lot of people, first of all, when we use the word sedentary, no one likes to think of themselves as sedentary. People will tell me all the time, oh, I have a busy job, I'm not sedentary at all. And that might be true, but when we start to look at these definitions of what it actually entails, then they might be more sedentary than they think that they are. So take a look at like light active and low active. And even if I just wanted to be considered active, what I'm talking about here in a definition terms says, in addition to the activities of low active, so that means I have to be doing all these, I will have an additional 3 hours of activity, such as bicycling, like 10 to 12 miles an hour, or walking 4.5 miles an hour. So what this means is I need to be doing a lot more. So most people are not as active as they say that they are. So what we find is that most people, well, bed rest is about 1.2, right? But it can also be just seated or standing activities, office work, driving, cooking, and no vigorous activity. No more than a 1.3 should be given. And so that's the point that I want everybody. Now, could you do a 1.25? You certainly could, and that's where you use your justification that you have as a practitioner to be able to make that determination. But I want you to start seeing here as we start to move into this, even if I was low active, what we're saying here at a 1.5 is that in addition to the activities of a sedentary lifestyle, it's 30 minutes of moderate activity equivalent to walking 2 miles in 30 minutes. Most office workers with additional planned exercise routine. So this is someone like me who works, even though I'm standing all day and I'm lecturing on Monday, Wednesday, Friday, and I have a standing desk in my office. But then what do I do on my lunch? I go out and I walk around with Dr. Herzig, right? We walk for 30 minutes. So we walk around the campus. Could I consider myself low active? Yes. Okay, so I might be able to. And also take a look at this, that between 1.3 and 1.5, where's 1.4? So you could give somebody a 1.4 right here. So this is just the areas that I want you to start seeing, is like, how active would we really actually use those? Now I can look at this one, and this one's still a little bit differently, because this one says moderately active and it ranges them at 1.5. So moderately active here is a 1.5, where here it's considered low active. So, you know, this is where it's important to kind of understand these. Now I posted this one here, not so much because I believe in these definitions here, but because I believe more in these ones. These have much more of a sound evaluation tool to them. But this one I thought would help you guys in the calculation process of this all. So once you have your resting metabolic rate here using your Mifflin St. Jean. This is the number that you'd have here. Now you have to attach this activity factor based off of these things here, the numbers that you would pick, which I would actually pick from here, and then that's going to give you your daily energy needs. So that's the only reason that I'm actually having this here. Not that I totally agree with these two here. I just liked this graphic to be able to get that to you. So today, what we're going to look at is a 58-year-old woman who's coming in to see the dietitian. She's 5'8", she's 160 pounds, and we're going to call her moderately active using the Mifflin St. Jean. So in this one, the moderately active at 1.5, okay? But again, do I really think she's moderately active? She'd have to be up here. She's probably really low active, but this is what it is. But we're going to call her moderately active. And I gave you the 1.55 to use. So, but if you don't have something to use, then I want you to use this guideline right here. Okay. So in this case, looking at this patient, if I chose a 1.55 activity factor, I would do my Mifflin, and then I would actually, after I get my number for my Mifflin here, what am I going to do? I'm going to multiply it by 1.55, and that's going to give me my number out here. Okay, so when I do that, I come up with about 2,100 calories. So that's the average that I went with here as far as rounding. So you will need to be able to do this. That was in the prior lesson case study that you had to do. So I'm not going to work through those with you here, but make sure that you know how to do that. And now this patient who's coming in to see me is telling me that she has a high school reunion coming up and she needs to lose 20 pounds in the next 2 weeks for her high school reunion. Now, both of us are going to know, you guys are going to know that's unrealistic. There's no way that she can do that. But how do you convince her of that? And that's where sometimes using the math that we learn will actually be helpful for her. So you might ask her something along the lines of, have you heard that there's 3,500 calories in 1 pound? So if someone wanted to lose weight, they need to burn the 3,500 calories in that particular pound to take it off of their body, right? People kind of know those numbers. So if you use that, I use it the reverse way, and that usually helps them rationalize it. So what I typically will do for them is I would say, okay, so you need to lose 20 pounds. Here's your 20 pounds. And then we know that there's 3,500 calories in a pound. So if I just times that by 20 pounds, that tell me how many total calories you would have to lose 20 pounds. So when I do that, it's 70,000 calories. So 70,000 calories, how fast could you lose 70,000 calories? Well, you're wanting to lose it in 2 weeks, which is 14 days. So then I take that 70,000 kcals and I put it into that 14 days. So when I divide 70,000 by 14 days, I get 2,500 calories a day deficit that this person would have to have. Okay, so oh, and that's a typo on my part. That's supposed to be 5,000 calories right there. So I'll fix that. So once I have it fixed, 5,000, like everything else. So the client would have to burn at least 5,000 kcals every day for 2 weeks. Could somebody do that? Can you burn 5,000 calories a day and still sustain? Well, she could stop eating, but even at that case, she only needs 2,100. So we still have to have a deficit where she'd have to do something besides not eating. And that's the point that I want you guys to be able to get over to her is that, okay, so even if you stopped eating, you were eating just liquid, water, and ate absolutely nothing else. Now, in addition to that, what else would you have to do to pick up that deficit that you would need? So one of the ones that I like to use is just, and again, it does depend on the weight and things like that. But overall, if we look at running, if someone's running at about 5 miles an hour, they can burn 500 calories in about 50 minutes. So if this person has to lose the 5,000 calories, I'm going to divide that by the 500 calories per hour, and that's going to tell me 10 hours that this person actually has to have to lose the weight. So that means no eating and being on a treadmill 10 hours of the day. Well, they still have to sleep and they still have to work. So is it actually feasible? And that's where we need to kind of look at these things and see. So that is how I usually get them to see the light, that they're not going to be able to actually maintain and in 2 weeks make that kind of behavior change. But What it will do is also help us with the next equations that I do want you to work on as well. So it helps bring the light to them, and then it also helps us figure out how could I come up with a plan for someone that needs to actually lose weight. So you've probably heard of the 1 pound a week being a healthful weight loss. And again, if there's 3,500 calories in a pound, if you divide it by 7 days in a week, what's the number that we need to get per day? 500, right? So if I was taking the 500 away from my patient that was 58 years old that came in to see me, then that would give me 1,600 calories a day. So then I could put her on a 1,600 calorie a day type of diet plan and see how that works for her. So that's an option. Now, is 1,600 calories a lot of food? That's where at some point when you guys start to go working out, you'll do this a lot more with Dr. Herzig, but you'll start to look at it in the 1,600 calorie diet, portion sizes are small. And so it could possibly make you hungry. So I don't know if that's too much or not. And I mean, that's too much for her to be able to handle at 1,600. So maybe what we could do is, because she is moderately active and she is doing stuff, could I get her to do just a little bit more in her workout that they would burn more calories, and then I could allow her to eat more food. So in this case, what we're looking at here, this is the one I want to direct your attention to, is looking at maybe a 300 calorie a day deficit. So that means that she's willing and able to do 200 more calories in exercise a day, and then we can cut the rest of 300 in the calories. That would then bring her up to 1,800 calories per day. And that seems much more like a doable diet. So in that case, that might be more of a better diet plan for her, is to use diet and exercise. And that's what we tend to find helps a lot with people. But sometimes there's people that just are not going to do exercise. They're going to tell you, I'm not going to do exercise. I just want to do this with diet. Well, then this is where we have to, go with a lower number. Now, I've posed additional questions here for you about 2 pounds a week. And what do you think about 2 pounds a week? And if that then means, if it's 500 for 1 pound, then that means what? It's 1,000 for the day. And then what do we do? So if we had this patient, 2,100 calories minus the 1,000, now that puts her on 1,100 calories per day. Now, what I'd like to know from you, to know that you're processing this, is I have a discussion question for you to answer. And in that discussion question, I'm actually looking for your thoughts on this. And there was some reference in the textbook. You can also go outside the textbook. You can do some research. But I want you to tell me, what do you know about providing 1,100 kcals per day to people? And is that something that is doable? So you guys figure it out, do your research, and then ring in with your answers and see what your classmates are also doing once you post your answer. Okay, so I hope this was a fun little lecturette to kind of get you thinking about how it is that we're going to get people to see the realistic goals that we need to set for them. So, all right, I will see you next time. Bye, class.